Good morning, everybody, and can I start by thanking, as I do most days, more than 56,000 people that came forward for testing. That is a great result, and we've seen those testing numbers stay at very high levels consistently during the lockdown, which is exactly what we want to see. That gives us a greater degree of confidence that we're capturing all the cases and that we're not missing any chains of transmission that might be active in the community. I also want to stress that today the weather is great. And I ask everybody to make sure that you respect the rules we've put in place. Make sure if you're outdoors exercising in a group of 10 that the 10 doesn't become 20, and Deputy Commissioner Warboys will certainly have more to say about that in his report. But overnight, as predicted, we had 35 cases of community transmission. Pleasingly, 9 of those were infectious during the time in the community that we understand out of that 35. So whilst, as predicted, the number of cases are going up, we're seeing a greater proportion of those cases in isolation, which is exactly what we want to see. So the green shoots are there. The green shoots of the lockdown doing what we hoped it would is certainly there. We haven't seen a huge surge in cases, and we certainly feel through our contact tracing that we're not at this stage missing any chains of community transmission, but it is really up to us. It was exactly a week ago that we as a government took the difficult decision to ask many residents in New South Wales to stay at home. And again, today we do that. Please, let's not give up now when we're doing well. The green shoots are there of demonstrating the lockdown is having the desired effect. And certainly what was pleasing for me was to receive an update about fewer cases being exposed to the community, even though the number of cases is going up. That means that those in isolation may have tested positive, but they weren't exposing the virus to others in the community, and that's exactly what we wanted to stop. That's why the lockdown is in place, to stop that community transmission. But as Dr. Chant will update in her report, if you do want relief from your home today, if you've been staying at home and doing the right thing, please avoid shopping centres or indoor areas. If you do feel you need to get out of the house for exercise, please go outdoors. The weather is great. We know the virus transmits less when you're outdoors, and please make sure you keep a good social distance. Even if you're with people you know, of course, anybody outside your household, you should maintain a social distance with. If you're exercising with people that are not from your household, please make sure you keep that social distance. And where you can, if you want to get that exercise, please avoid shopping centres or indoor areas. That's where the virus is transmitting. But obviously the difference is, because we don't have large venues where people are exposing large numbers of people, those cases we are seeing in the community are at venues where fewer people may have been exposed. Having said that, we know the next few days are critical. Let's not give up, but instead keep respecting what the stay at home and the lockdown means. And I am so grateful that all of us have come together to do the right thing, because if we didn't, we would have seen those numbers go through the roof, and we would have seen many more cases of exposure in the community and not in isolation. We want this trend to continue. If we want to get out of this lockdown as soon as we can, we need that trend to continue. So can I please urge people to be sensible today, especially after a week of having to stay at home but for essential purposes. I know that people will want to take advantage of the weather. Please exercise sensibly. Please maintain your exercise outdoors and avoid indoor areas where we know the virus has a greater chance of transmitting. I'll now ask Dr. Chant to give her update, and then Deputy Commissioner Warboys will say a few words on compliance and how important it is for all of us from a police perspective, but obviously from a health perspective, to do the right thing.
Thank you, Premier. So New South Wales recorded 35 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 29 of those cases were linked to previously confirmed cases, with 14 of these being household contacts. And 6 cases remain under investigation, and we had 5 new cases were acquired overseas. In essence, the testing numbers were 56,331, so down slightly. And again, can I redouble my request for people to come out and get tested? The sooner we can detect any unrecognised chains of transmission, we can slow the spread of this virus and move back to a position of no community transmission. Every person who tests positive, by coming forward early and not delaying, so at the earliest point you get symptoms, please come forward and get testing. Because what we're finding is that this virus spreads so rapidly in your household that when you test positive, a few days later or even at the same time, we're seeing the rest of the household turn positive, and we want to reduce those risks in the community. Of the 35 new locally acquired cases, 23 were in isolation throughout their infectious period. A further 3 cases were in isolation for part of their infectious period, and 9 cases were infectious in the community. 6 cases remain under investigation. So what we're encouraging you to do is to minimise your retail going to shopping, minimise as much your exposures in indoor settings. Stay socially distanced. I was pleased that I did get some groceries this morning and picked up some bread, and it was fantastic to see that community lining up, many wearing masks, because we've also indicated even if you're in an outdoor environment and you anticipate you can't socially distance, wear a mask. It was pleasing to see everyone politely stepping back, giving people distance as they were waiting for those takeaway coffees. And I just urge people to minimise their exposure in places like retail and supermarkets over this weekend. Instead, go for a walk in your household group around the block. You can go to your local park, but keep a distance from anyone else. We want to make this, we really appreciate the community's compliance with this, and I think the community understands the difference between indoor exposures, not being tempted to have people over to your house, whereas we're giving people a bit of freedom to walk around the block in a household group, go down to the park, stay in that household group, to give them a bit of reprieve. Thank you. In terms of the cases today, I just wanted to, there has been a lot of discussion around the healthcare exposures, so I thought I might just take a moment just to describe a sequence of events. So New South Wales Health identified a student nurse who tested positive on the evening of Tuesday, the June 29th, and this case was announced on Wednesday because she'd worked whilst infectious at Fairfield and Royal North Shore Hospital. Testing of her close contacts identified an additional 8 cases across 3 linked households, and of those 5 worked in aged care and healthcare, and 2 had worked at Summit Care and Baulkham Hills whilst infectious. 1 had worked at Royal North Shore, Royal Ryde Rehab Hospital and Fairfield Hospital while infectious, and the others had not worked whilst infectious. Follow-up investigations at the healthcare facilities have identified 2 further cases at Royal North Shore Hospital, including one of today's cases, who was identified as a close contact of the student nurse. This case did not work whilst infectious was fully vaccinated. And there are therefore 2 cases who acquired their infection through healthcare exposure, but both had not worked whilst infectious, and that's the rationale. If we can detect cases, we can then remove them from workplaces and make sure we don't see ongoing transmission. We're obviously very watchful, and I appreciate the efforts of staff, but also patients. We're doing regular testing in those facilities because, as you know, we need that full 14 days to ensure that there wasn't transmission from those healthcare worker exposures. In terms of other settings, I'd like to just highlight is I want to just give a big call out to some people in the Central Coast who had acquired the infection through exposure at Ocean Foods. We didn't have their details, but they'd watched the media and followed the health advice. So when they tested, and when they came up positive, they'd been isolating for the full period and posed no risk to the community. And I think that just highlights the fact that we need to work together as a team, but I just really wanted to extend my appreciation to those individuals. In light of the community transmission in Auburn, New South Wales is advising anyone who visited Auburn Town Centre on or after the 27th of June to get tested for COVID, even if you do not have any symptoms. People with no symptoms who have not been to close or casual contact venues need to really maintain as much as possible that isolation, but obviously can go for urgent healthcare visits and other things. So we are asking for a really strong push in that Auburn community, particularly those who've been around the Auburn town centre, because we have seen some cases where there may have been exposure in that environment. We've also had a detection in the Penrith sewage treatment. Now, there may be an explanation for that in the sense that a worker worked there for a short period of time. However, with repeat testing's also come up positive, so we do want to call out the people in the Penrith sewage treatment plant area. So that's Cambridge Gardens, Cambridge Park, Leonay, Emu Plains, Glenbrook, Penrith, South Penrith, Glenmore Park, Jamestown, Regentville, Lapston, Orchard Hills, Kingswood, Castlereagh, Cranbrook, Lanedo, Sun Valley, Mount Riverview, Emu Heights, Jordan Springs, Mulgoa, Warranoo, Blaxland and Yellow Rock, as well as in the Blue Mountains National Park, to be particularly vigilant and come forward and get tested at the earliest point. So as the Premier said, it's pleasing to see that testing numbers have remained high. It's pleasing to see we're seeing more people infectious, less numbers of people infectious in the community. And obviously we're seeing, because of the lockdown, that the settings in which people have unknowingly been infectious in the community are much lower risk settings. But it does highlight the fact that we need everyone, as we move about, to make sure you assume that the person next to you has COVID. So please stay with us on the journey to get to that no community transmission.
Thank you, Dr. Chair. Premier, Minister, good morning, everyone. In the last 24 hours, 78 personal infringement notices issued to people for going outside the public health order. Of notice is that the reports to Crime Stoppers continue to come in and increase over the last few days. Last 24 hours, near 350 reports to Crime Stoppers, people that are witnessing behaviour that contravenes the public health orders and reporting that to police, and we've always said we will take action on that where we can. One particular item of interest is a cafe down at Jindabyne. Remembering we're in the middle of the snow season and school holidays, police tried to work with this cafe. There were infringement notices issued, and in fact more recently one of those people from the cafe, one of the owners there, was arrested and placed on bail conditions for working that cafe outside of the public health orders. Crime Stopper reports again from people in that area, and I guess people who want to use that cafe, about non-mask wearing and no QR coding requirements. That was reported to Public Health, who have issued now a show cause notice to the cafe owners as to why they shouldn't be shut down. So the next step will be, if that cafe refuses to comply with the public health order, putting people's health at risk, I'm sure the Health Minister would only be in the position to issue a closure notice under the Public Health Act to that premises. So that's the escalation of events that both police and health are prepared to take to make sure that people not only comply with the public health orders, but they also protect their customers and their workers. Another incident of note was 3 people who decided to travel from Sydney to Jenolan Caves because they were feeling a little bored, was the example or the reason that they gave. Once they got to Jenolan Caves, the tour operator there realised where they were from, called police. Those people were returned to Sydney and issued each an infringement notice for $1,000. People need to be aware that it's not just a choice about being bored. It's not then just a choice about where you might travel that particular day. Be aware of the LGA that you live in, where you intend to go, and what the public health orders say. It is quite clear now that people will report this sort of behaviour to police, and we will take action. The other one of interest was at Tuggerah Lakes, where a group of people around 11 p.m. last night decided that they would leave their home, go to the industrial area and prepare their vehicles and the space around them for some sort of burnout activity. Police were notified, attended there, and each of those persons, clearly without a reasonable excuse to be out of home, were all issued with personal infringement notices for $1,000. We've heard today about the need for people to comply with public health orders when they're particularly outside exercising. We're blessed with a beautiful day today and tomorrow. Police would much rather not issue personal infringement notice. We would much rather see people comply with public health orders. And what I would say here today is that the vast majority of people that police come into right across this state do the right thing. They do the right thing by themselves, their family and their communities, and we would much rather be out there highly visible and having people do the right thing. So please be with us on this journey. Please, people, take note of what the Premier, the Chief Health Officer have asked us to do this weekend. I guarantee that police will be visible right across New South Wales. We will take action where we have to, but we would much rather not. Please comply with the orders.
Thank you, Deputy Commissioner. I just want to emphasise to our community the importance of following health instructions. We are deep in a war with this virus, and we can't win this war unless the community are all with us, absolutely. Now, most of the community are with us. Most of the community understand the weapons we have in this war, QR codes, getting tested if you've been at a venue of concern or if you have symptoms, any cold or flu-like symptoms, and of course, wearing masks. When you're in a war, you don't win it with wacko views. And unfortunately, we're seeing that with some people who think that it's okay not to wear masks. My strong message to the community is we will only win this war against the virus if people wear masks and follow all of the other instructions that we understand will keep us safe. We owe this to ourselves, we owe this to the community more broadly, we owe this to our families. Wear a mask and don't get caught up in the wacko views that some are expressing.
Premier, it's 6 days away that Sydney-siders are supposed to be released from lockdown. When will you make a decision on whether that will be happening?
Well, look, obviously the health experts are giving myself and my colleagues advice on a daily basis, and we obviously look for those opportunities to assess the situation. I anticipate that obviously sometime next week we'll be in a position to tell the community where things are at. It's a bit too soon at the moment. We have seen the tide turn, we have seen those green shoots, but I also want to stress in particular, on top of what Dr. Chant has expressed, that we're seeing the virus, the central focus of the cases now shift from southeast Sydney to parts of Auburn, southwest and western Sydney. We want to make sure that the essential workers who've been caught up with the recent cases are isolating, which they are. But I just want to give a special call out to our communities in Auburn, in southwestern Sydney and western Sydney in particular, to please watch for symptoms, come forward and get tested and to follow the health advice, and please avoid unnecessary time in indoor settings. If you do feel you need to go out of the house, use that exercise in an outdoor setting. Please avoid indoor settings because that's where the virus is transmitting more rapidly. And please follow the health advice. So just a special call out to say that if all of us continue to do the right thing, we're able to leave the lockdown in a timely way. The next few days will be telling, but so far I'm relieved that there hasn't been a huge surge in numbers. I'm also relieved that the tide seems to be shifting in relation to the number of people who've been in isolation that are getting the virus as opposed to those who've been exposed in the community, and that's positive news. We should hold on to that. But I don't want to see all our good work ruined today and tomorrow because the weather's great and people are deciding not to follow the orders. So can I please ask everybody, we've done so well so far, let's not waste it because the weather, the sunshine's great and we're out there mingling when we shouldn't. So please avoid any social contact with anybody outside your household. If you're exercising with other people outside your household, please maintain the social distancing. Please make sure it's outdoors. And avoid those indoor settings. So we have an opportunity to keep sticking together, doing the right thing and getting out of this lockdown as soon as we can. And that's essentially what I'm pinning my hopes on. I'm putting my hope in the people of our great state to continue to do the right thing, to follow the health advice. And I can say the numbers are telling. We always base our decisions in New South Wales on the health advice and the science and the data. And there has been a shift in the last 24 hours and we want to see that shift continue. We want to see that trend continue. We always assume there'd be a high number of cases, but so long as the majority of those cases are in isolation, that's less concern, and that's exactly what we've seen overnight. If we continue to see those trends, we have a greater chance, of course, of getting out of the lockdown in a timely way.
Are you
Premier,
concerned
it's
that the airlines are taking advantage of the cap on international travel? We're seeing a spike in the price of airline
So I didn't
tickets.
get the first bit of the
Are
question.
you concerned that the airlines are taking advantage of the cap on international travel? We're seeing a spike
No,
in the
I'm
price of
actually-
airline tickets.
I'm just disappointed that more Australians will have to wait before coming back home. New South Wales has always done our fair share, and again, the number of people coming home doesn't change the risk. This is a very transmissible variant, the Delta strain as we call it, and I'm disappointed that the other state leaders didn't see fit to maintain the number of Aussies coming back home, and that to me is a disappointment. But of course, we'll respect what the National Cabinet decision was, and move forward in that regard.
Premier, it's absolutely
Sorry, just asking. Yeah.
Premier, it's absolutely packed down at Bondi today. It's chaos in Centennial Park. You can't even get a park down there. Are you worried this weekend is going to undo everything that we've done in the last week?
I'm absolutely concerned that the weekend's good weather and the fact that all of us have been kind of cooped up the whole week, especially for kids during school holidays, that people will let their guard down. Please don't let your guard down. Yes, it is great weather. We live in the best place on earth, but please be sensible. If you are exercising with others outside your household, please maintain the social distance. Don't let a group exercise of 10 become 20 or 30. That is a surefire way of spreading the virus. But having said that, we want people to avoid those indoor settings. We'd much prefer people exercising outside in a safe way, in a socially distanced way, and we just ask people to not give up now. We're actually at the halfway point. We're at a good position. The lockdown is having the impact to date that we thought it would. There's nothing surprising we've seen in the numbers, and of course, as the days go by, we want to see the numbers of people who've been exposed in the community with the virus continue to decline, because that is one of the measures Dr. Chan and her experts will use when they're advising government on what we should do. We have a chance to get out of this lockdown as soon as we can, so long as we don't let our guard down and suddenly let the virus spread today and tomorrow because of the good weather. So I just appeal to everybody to do the right thing. The lockdown is so far having the desired effect, but we need that to continue so that the advice we get from Dr. Chant will be pleasing to all of us.
Premier, just back to the arrivals cap.
Well, that was outlined in part of the phases which National Cabinet adopted, so absolutely.
Premier, just back to the arrivals cap. Will that or this current outbreak have any impact on the plan to bring back international students?
I'm sorry, potentially, because you know, unfortunately, New South Wales has always been extremely ambitious in the way in which we approach dealing with COVID, and it does cause us to reconsider all of those things. The other states clearly have indicated they don't want to continue to welcome Australians in the number we had, and it does also impact then other people you can welcome home. And so I think it does put those plans, put a huge question mark over those plans. But New South Wales has always done our fair share, and I again want to stress that just because you're welcoming home less Australians every week doesn't mean outbreaks aren't going to happen, mistakes aren't going to happen. In fact, quite the opposite. We've seen some states bringing home far fewer Australians than New South Wales is having those outbreaks and having those concerns. So it doesn't mean we're not going to face these outbreaks until the vast majority of our population is vaccinated. We're going to see this situation arise, but I hope every Premier keeps to their word in the commitments yesterday in relation to avoiding lockdowns and proceeding on a basis which gets us to a COVID normal.
The Prime Minister's...
About 6 months ago, you said on multiple occasions before the vaccine rollout had even started that your biggest fear was that Australia would be left behind as the rest of the world starts to open back up. Is that exactly what is happening right now?
Oh, look, I think we have the potential to catch up very quickly. We are a resilient, strong nation. Even though we've got a pause in the number of vaccines we're getting now, we know that come September, October, according to what the Commonwealth is telling us, that we're going to get a whole lot of supply. And that's why I've been vigilant in making sure in New South Wales that we're working with our GPs, we're working with all of our facilities to really bump up the opportunity to get those jabs in arms. So we really need to think about what the world looks like in Australia between now and when those vaccines are available. But I do think we have the potential to catch up. We have the potential to work together and catch up. But that is a risk, and we need to make sure that when those vaccines become available, that all states, including the one I lead, are ready to put those jabs in
The
arms.
Prime Minister's 4-stage plan does depend, though, on us all getting the vaccine. Is there enough Pfizer to meet his timeline?
Well, that's something the federal government controls, and so you know, we get a snapshot of what we're likely to receive, and we are being told that in September, in particular, September and October, that there will be a huge uplift in the vaccines we receive, and that's welcome news. But that's why I've been arguing that you have to do the work now to make sure you have those extra people available to put the jabs in arms, because if you suddenly get a whole bunch of doses you haven't had before, the challenge then becomes to make sure you use them as quickly as you can, and that's why I've been calling on through National Cabinet process to make sure that we have as many GPs signed up as possible, and of course in New South Wales we've announced additional mass vaccination hubs and points of access, but also that we get the pharmacists on board and also corporates. I'm really hopeful that many corporates will have the opportunity to vaccinate their staff in the workplace, and these are all the things we need to do the work for now. There's no point waiting till the vaccine arrives. That's too late. You have to do the work now to make sure when the vaccine arrives that we have our systems ready, because certainly my sense is our population wants to get vaccinated. The vast majority of people know that getting vaccinated is the key to our freedom in living a COVID normal life, and I'm really encouraged by that and look forward to that.
Is there a crisis at North Shore Hospital with staffing levels in the wake of this student nurse? Are you concerned with the way operations are going there and the effect that it's having on other staff members?
The best advice is no, but I will ask Dr. Chant to see if she has any updates on that.
First of all, can I just give a big call out to the staff of Royal North Shore Hospital? Can I just give the time sequence of events just so people understand? When we first became aware that a student nurse, an AIN, was working at North Shore Hospital, we, that night, the chief executive of that local health district, one of the infectious disease specialists, an infection controlled nurse, attended that hospital at 1 a.m. in the morning after hearing about that confirmed at about 11:50 at night. They tested staff throughout that night, and they tested patients, so that throughout the hours, a comprehensive plan for controlling this exposure was put in place. That was effective in the sense that one of the staff members who subsequently tested positive wasn't working whilst infectious because they'd been identified as a close contact, which is the aim. So close contacts were identified rapidly. Of course, we've had another nurse, another healthcare worker test positive there, and that then also meant that there are some extensions and other impacts on other wards. But we have a great healthcare system. There is stress on our healthcare system overall, and we do ask people to be patient. There were some impacts on elective surgery, some small impacts on elective surgery, and we work as a system, so there might be times where we redirect patients to certain areas. But the staff of North Shore have done an amazing effort in responding comprehensively, and I just want to extend my gratitude to them, but also to the patients, because we will be swabbing the patients very frequently. We're not out of the woods yet. We obviously have to wait for that 14 days since their last infectious period, and so we are keeping a very close eye on circumstances.
Have you had to close down wards though?
So what we do is when we've got a case, it's a bit like a case in an aged care facility, we lock down the ward. You don't want any movements in and out of that ward when you've got a group of people that are exposed. That's one of the basic premises of public health. You want to contain, make sure you've got only staff working there that are wearing even upgraded PPE. You've got to assume at any time a patient could be infectious. All of those procedures are put in place.
But shutting down a ward is different to closing it and moving people out. Is there a staff crisis here that has forced you to change the way the hospital operates so that different wards cannot be used as they were before?
So a range of actions get taken when we have this. So, for instance, there'll be we will try and minimise all staff movement across the hospital, because what you want is if you have a case in a healthcare worker that you've not identified as a close or casual contact, you don't want it impacting more broadly. A comprehensive plan's been put in place at North Shore, and then North Shore is part of a connected hospital system that we have in New South Wales, where other hospitals will support them if there's any issues. But at the moment, if you've got an urgent care and a need for health care, can I again emphasise that please do what you normally would do. Ring the ambulance or seek advice from your general practitioner. Health services are operational.
You can't foreshadow any problems with the ED or other parts of the hospital as a result of this outbreak at North Shore?
So in terms of the emergency department, this actually occurred, the exposures were around wards, particular wards in the Royal North Shore Hospital. The patient actually it's not like a patient who had been admitted through the ED. So obviously it has an operational impact, but we are, and I just want to acknowledge the staff who are working to make sure that that has minimal impact on patients and care. And as I said, we have a connected healthcare system, and that's one of the strengths where we can work as a network and support if there are any gaps or areas where North Shore may be experiencing some challenges.
So you have the confidence of your staff, then you're satisfied that they're not calling in sick, avoiding the area, unhappy with the way this has been handled?
Look, I've had none of those issues raised with me. I just want to reassure the community that prompt action was taken in relation to the exposures in the aged care facility, as well as the aged care facility, Summit Care, and also at Royal North Shore, Fairfield and Royal Ryde. And it was pleasing to see the cooperation of many multidisciplinary teams in putting in those plans to protect the safety of staff and also patients, whilst attempting to minimise any impact on patient care.
Dr. Chan, is it realistic for anyone in Greater Sydney to think that we're coming out of this lockdown in 6 days?
Oh, look, I'm forever an optimist. We will brief and look at the data, but the things that the community can do to absolutely give us the best chance of me being really happy, and that takes a fair bit, is we just need people to come forward and get tested, and a big call out to the communities in southwestern Sydney and western Sydney. This is a time where the focus needs to shift from southeastern to those communities in southwestern and western Sydney. Please, a big call out. Come out in, look at the websites, community leaders, everyone get the message out about where we're really concerned about those potential areas where there might be unrecognised transmission. The next few days will really disclose the pattern. As the Premier said, there were some glimmers of hope last night that we'd actually seen more people in isolation. A number of the links were made, and we've solved a couple of puzzles overnight. That all gives me confidence, but it's a day by day. So what the community can do is come out and get tested and not try and play with the rules. I think we've been on a journey, and everyone knows that outdoor environments are fine. We do need, if you're cooped up and you've got children, take them to a park, stay a distance from anyone else, let them run around. That's a low-risk exposure rather than being tempted to allow people into your home or think about other more risky activities of going to retail. So if we can all just work together, we are very privileged to have this temperature and this environment at this time of year. And the more you can be safely outdoors. I don't want to see a surge of people outdoors, but we do need to understand that people can walk the dog around the street. Don't talk to your neighbours.
Doctor, the numbers haven't started going down yet.
So what
is this lockdown just a bit half-hearted?
No. So absolutely not. So what we've actually seen is the sorts of exposures that people have when they're infectious are the fact that they've gone through a drive-through to pick up food, right? They've now, yes, that's a theoretical risk, but pretty remote given the remoteness where you usually tap at the card and not have things. When you're picking up your coffee or your bread at the bread shop, being in and out really quickly and not going in if there's a bunch of people. I've observed today, I know it's a small sample size because I really haven't got out, but I was really impressed that everyone was standing back and giving people distance. And in those settings, outdoors, people were still wearing masks because obviously they'd envisaged that they may be put in a situation where they're having to go. They might have not been able to maintain that 1.5 metres. It isn't a half-hearted lockdown. We are seeing the impact and the flattening, but we've had bumps because what's happened is we've had some super spreading events. We've certainly had, more recently, we've picked up some people that have been infectious in the community for quite a while. And so hence my key message, go and get tested. But what you can see is when you test, when someone's been infectious in the community, by the time we get to them, if they've had symptoms for a few days, the rest of their household has already been infected, and that's too late. So again, the message is don't delay. The most minimal of symptoms. Don't think that scratchy, itchy throat's going to get better tomorrow. Don't think that runny nose, that headache, that loss of taste and smell, any of those COVID symptoms are going to just magically resolve tomorrow. I want you out and get tested. That will help us know we're not missing any undetected chains.
Thanks, everybody. Thank you. See you tomorrow.
Thanks, guys.